Unwanted pregnancies and unsafe abortions can have significant medical consequences, including illness and death. So, what I'm hoping that we can do is continue to increase access to New Jerseyans, but I really hope that we can somehow reach those patients from other states who access has been banned or severely restricted.
Welcome to Pod Talks. Pod Talks is a project of protecting our democracy. We bring together the best minds in New Jersey and beyond to talk about some of the biggest challenges facing our democracy, our institutions, and our personal freedoms. I'm Sean Spiller, Chair of Protecting Our Democracy. Today, we're going to focus on reproductive rights and access to abortion health care. And I'm honored to be joined by three people who bring incredible expertise and knowledge to this discussion. Joining me today are Kaitlyn Wojtowicz. She is the Vice President of Public Affairs at Planned Parenthood Action Fund of New Jersey. In that role, Kaitlyn oversees government affairs, policy, communications, and advocacy efforts. Kaitlyn has been active with Planned Parenthood since her undergraduate years at the College of New Jersey, where she graduated in 2010 with a degree in English and Women's and Gender Studies. Kaitlyn has a master's from Rutgers University in Women and Gender Studies as well. While Kaitlyn devotes her professional life to advocacy for the people of New Jersey in her free time, I understand she enjoys spending some time with her rescue dog, Jersey. So
Thanks, Sean.
Great to have you on, and thank you for being with us. Rahbbea Norton-Lee is a women's health nurse practitioner who has worked for Planned Parenthood of Northern, Central, and Southern New Jersey for 10 years. Rahbbea started as a registered nurse with an affiliate and now has a dual role, serving as a healthcare provider, the associate medical director. She's a member of the New Jersey Maternal Care Quality Collaborative, a maternal health task force formed to improve maternal health outcomes in New Jersey. The priority of her work is to provide for exceptional reproductive health care in underserved communities as a Black provider. When Rahbbea is not working, she enjoys traveling and relaxing on beaches. That's always a good one, by the way. Who doesn't enjoy that with her husband and son? And welcome to you as well. Thank you for joining us.
Thank you.
Jeanne LoCicero is the legal director for the American Civil Liberties Union of New Jersey, where she supervises the litigation program and related advocacy of the ACLU New Jersey's legal department. Jeanne has litigated and advocated in a wide range of civil rights and civil liberties cases with a focus on prison conditions, racial equity, LGBTQ rights, women's rights, reproductive health. She recently served on New Jersey's Transgender Equity Task Force, Equality Task Force. Jeanne started her legal career as a legal fellow at the ACLU of Alabama after graduating with highest honors from Rutgers School of Law in Newark. She spent 3 years in private practice before joining the ACLU New Jersey. Thank you for joining us as well.
Thanks so much, Sean.
Well, again, I want to thank each and every one of you for coming on today and just talking about something that I know is a major focus, because really for so many years, I think people, viewed us as seeing progress and then maybe some stability. But certainly now, and probably focus right on the Dobbs decision, we really see what feels like a rolling back of rights, rolling back of things that we've fought to win. So let's start there. When we look at that national landscape, and we know a lot's happening state by state, right? And the challenges we're facing, but certainly it's got that national piece as well with the Supreme Court and the decisions that are coming out of the Supreme Court, specifically around reproductive health care and abortion rights. What are some of the legal looming pieces that are there? What are some of the things that we should, expect in the future? What should be on the lookout for going forward? Jeanne, maybe I'll start with you to give us, what do you see at that national level?
Sure. So Dobbs, which happened last year, is the decision by the U.S. Supreme Court that declared that the federal Constitution no longer protects the right to abortion. And so we kind of have to look back to Roe v. Wade, right, to think about what the landscape was and where we are now. And so in 1973, Roe versus Wade established that abortion was a constitutional right and ruled that the federal Constitution's privacy protections encompass that really personal patient decision about whether to continue a pregnancy or not. And so I know Dobbs feels very sudden and shocking, but it was a 50-year campaign by a well-funded extremist folks, activists who started chipping away at abortion access from the get-go. And so there was just a barrage of attacks through the 70s, 80s, 90s, continuing through today, with Dobbs being the culmination of that. And so there were, they weakened the legal protections, and it really emboldened a lot of politicians, especially in the 90s and early part of the this century to pass restrictions that blocked access to abortion and other reproductive health care. And one key thing to note is that it really impacted people of color, low-income people, people in rural communities, young people in particular, right? Because these restrictions just made it increasingly out of reach, especially for people who already were facing systemic barriers to access to healthcare. And so, so one thing I like to point out is that I know in this Dobbs era, we often talk about returning to Roe or highlighting Roe, but Roe didn't give us what we needed. And so I think all of us who are in this movement really think about a broader fight for abortion justice and reproductive health justice. And so I just want to kind of point out that Roe was this legal regime that we kind of look back fondly now because of what we're dealing with Dobbs, but it wasn't what we need to make sure that everyone has access to abortion care.
Before I ask and kind of go, and Kaitlyn, maybe I'd ask you to focus on Jersey a little bit, but before doing that, maybe just a quick follow-up to that. When you note, and I think everyone agrees, you hear everyone speak of this, we talk about the long campaign, right? It was a campaign to get to Dobbs, right? There was a well-funded, your words, campaign to get. Do you think it was a little bit of complacency? Where was the well-funded, campaign on the other side, or do you think it existed but just wasn't successful in this instance, or how do you view the success of that well-funded campaign in the context of pushing back to it?
Well, I'll just say, from the get, people were people who support abortion, and I'm sure Kaitlyn and Rahbbea can talk more about the majority of Americans support abortion access, right? So let's not pretend this is like a really tight divide among Americans. But from the get-go, the ACLU's Reproductive Freedom Project was established in 1974, the year after Roe v. Wade was decided. And from the get was really, active in pushing back against these threats. But it wasn't just about, it was a broader campaign. And we've partnered with Planned Parenthood since the beginning and other independent providers across the country. And so it's really hard. I don't know, Kaitlyn, do you have thoughts on this? But it's hard to really think about how, I don't know if we had the same kinds of resources. I guess, I'm not a historian on this front. So I'll say, obviously, they were the anti-abortion extremists were successful ultimately, and there was a huge political component to this, and even developing judge candidates and all that kind of stuff. So I'll pass it to Kaitlyn or Rahbbea to add on.
And Kaitlyn, maybe I will go to you, but hopefully I'll just say this, maybe in not too long a period, we'll be sitting here talking about how did we successfully, prepare and do and it'll flip back. But yeah, Kaitlyn, maybe speak to that and maybe how it affects us here in New Jersey. We know in Jersey, we're a little bit different in certainly our support of reproductive rights.
But to Jeanne's point about this being a well-funded, decades-long approach to overturning reproductive rights at the federal level, I would be remiss if I didn't say that it's not over for those folks who are anti-choice. We look across the country, there are 20 states and counting with near or total bans on abortion access. Some of those bans come from laws that were passed pre-Dobbs in anticipation of one day Roe being overturned, so that immediately upon that happening, they had a law in the books that said either abortion is outright banned in this state, or it's banned at 6 weeks, or it's banned in certain circumstances. And so that was part of the campaign leading up to it. And like I said, 20 states and counting. When we look at, that's almost half the country without access in their state to abortion care. And then here in New Jersey, yes, we are different. And there are some other states too that have done really great protective work. In January of 2022, about 6 months before the Dobbs decision came down, the legislature passed and Governor Murphy signed the Freedom of Reproductive Choice Act, which guaranteed the right to reproductive health care, including abortion, here in New Jersey. And other states did that as well. At the same time, we know that rights without access is pretty meaningless. There are certain states where you still have the right to an abortion, but if you only have one abortion provider in the state, it's functionally inaccessible and your rights can't be exercised. And even here in New Jersey, there are gaps that exist that our coalition that we work with is striving to address, so that everyone, regardless of their insurance status, their immigration status, their zip code, their income, they're able to get the healthcare that they need and deserve when they need it. So that's some of the things we're working on here in New Jersey, but I just wanted to highlight that, to Jeanne's point, this has been an ongoing campaign, and they've been preparing for jobs since Roe was decided.
Rahbbea, maybe I'll go to you, in that you're a provider, you're a medical director, you're seeing what's happening, on the ground, as it were. Even in New Jersey, I would imagine that a lot of the things that we're seeing nationally, and certainly the counterbalance that we're seeing from New Jersey, is having an effect. What are you seeing day to day in your experience?
So what I will say is, the president of Planned Parenthood, Alexis McGill-Johnson, she pretty much said that the Supreme Court has now officially given politicians permission to control what we do with our bodies, deciding that we can no longer be trusted to determine the course for our own lives. So let's be clear, the overturning of Roe does not eradicate abortions. What it does is severely restricts or remove access to safe and legal abortions. Patients are traveling across state lines to receive safe and legal abortions. We have here in New Jersey, I know we've expanded health center hours and procedure days in order to be able to care for the increasing number in and out of state patients. And as a healthcare provider in New Jersey, my role is to provide care to all of those patients, no matter what. My concern and my heart goes to the patients that I do not see. Those are the patients who are unable to get to the health center, who don't know about the health centers, who are forced to continue with an unwanted pregnancy, or who are forced to perform unsafe self-induced abortions. Unwanted pregnancies and unsafe abortions can have significant medical consequences, including illness and death. So what I'm hoping that we can do is continue to increase access to New Jerseyans, but I really hope that we can somehow reach those patients from other states who access has been banned or severely restricted.
Jeanne mentioned something about the impact here, right, and the impact being disproportionate, right? Often we see underserved communities of color, others that have a harder time. When we see a legal change like this, what are you seeing, or maybe I'll stick with you, in terms of maybe even individuals who are coming from other states, or is it a disproportionate, disparate impact that we expect from something like this, or what are you seeing?
So everyone should have the freedom to control their decisions regarding pregnancy, childbirth, and abortion and contraception. Simply put, there's no space for politics in reproductive health care. We know that given our nation's history of racism, healthcare, the adverse effects of healthcare disproportionately falls on Black and Brown people and people with lower income. And so what we're seeing is the people with resources being able to get to us. So again, those people who are being severely impacted from other states don't have access, don't have the money. Kaitlyn mentioned earlier, she mentioned the gaps. And so sometimes even in state, we have patients that are coming to us that they can afford to get to us, or they might use their last money to get to us. But for many patients, deciding whether they should receive care or receive a procedure essentially comes between, do I go to get that procedure, or do I pay my rent or my electricity bill? And that's a burden, and unfortunately a common reason for why people opt out of not receiving the care that they need and the care that they deserve.
So you mentioned gaps that still exist in New Jersey. Maybe Kaitlyn, maybe I'll go back to you and just say, even in New Jersey, when we hear some of the gaps as described right there, what can New Jersey continue to do? What else can New Jersey do when we're trying to maybe eliminate some of those gaps or help people who still need it?
Absolutely.
What's
and I know Jeanne can speak to this as well, because we've worked together on a lot of these policy areas. The first thing that comes to mind is eliminating financial barriers. So we were fortunate enough to, as part of the Freedom of Reproductive Choice Act, put in a study through the Department of Banking and Insurance to take a look at the state regulated plans and whether they were or were not providing abortion coverage. The study found that there for the most part, were many plans that were and some were not. And then the regulations came down, basically said, for state regulated plans, abortion must be covered, which is fantastic. However, we know that for many folks, even with insurance coverage, if they have a high deductible plan or high out-of-pocket costs, that abortion can still be out of reach for them. Like Rahbbea said, they may spend their last few dollars getting to a health center or traveling, staying in a hotel, finding folks to take care of their existing children, and then they don't have the money for the procedure, even if they have insurance, because if we're not eliminating the cost sharing for the patients, they can't actually afford the care, even with insurance. And then we have an entirely other sect of folks who simply don't have access to insurance or Medicaid, largely because of their immigration status. And so that's a group of folks who are paying for things entirely out of pocket. We'd like to see an existing fund in New Jersey expanded that already provides for birth control and prenatal care to also include abortion coverage for those folks, because someone should be able to make any decision regarding the reproductive health care that is right for them, whether that's to prevent a pregnancy with birth control, continue a pregnancy and have it be healthy, or have a termination and have an abortion. So those are some of the existing gaps as we see them. And Jeanne, I don't know if there's anything I missed that you would want to highlight as well.
I think you covered most of the patient-centered ones. I guess I would say we've also worked in our coalition, and we started this before Dobbs. We've been working for years to expand access in New Jersey because there are many counties without any abortion providers. And so when we talk about travel, we're talking about women in New Jersey, or patients in New Jersey who have to sometimes travel 2 hours to find a provider. So let me just back up and say we've been working on eliminating regulatory barriers to care as well through the Bureau of Medical Examiners, and we're also pushing for policies that would support infrastructure for abortion providers that include, training and facilities and ways to ensure that New Jersey can have a thriving healthcare community that includes access to abortion for everyone in the state.
When you are describing that, when you're both describing that, and Rahbbea, I'll say something that you said when you noted, there's no space for politics. Well, the other thing is you noted is that politics has been, is fully inserted here and oftentimes makes those decisions as to whether things are going in the wrong direction or, in some of the things that you'd like to see improved on here, even in New Jersey, politics plays a huge role in that. So let's talk a little bit about, I guess, that political climate and maybe nationally in New Jersey as well, because I do think, they're kind of obvious in terms of them going hand in hand here. What do we see, I guess, as the current political battle and changes, and maybe start Jersey focused in this case? We have a very supportive governor. We've got a legislature that has been looking to act. There was some talk of some other actions that that were being considered. But what do you see on the political front in New Jersey? It's not that long before we have a gubernatorial election coming up. We've got all 120 seats in the legislature up. Where do you see us sitting right now politically in New Jersey as it relates to reproductive freedom and healthcare?
I'll just start. I mean, I don't do the politics as much as Kaitlyn might, but I'll just say that we need leaders in New Jersey that are going to prioritize racial justice and think about abortion access as a racial justice issue. And so I would recommend everyone listening to really talk to the candidates in their jurisdictions, in their districts, and really probe them on their commitment to access to abortion care.
One, I would just love to co-sign what Jeanne said about this is a racial justice issue as much as a reproductive justice issue, and healthcare is a human right issue. But to look at what could happen in New Jersey, I think we actually have to look to our past. It was not that long ago where Governor Chris Christie completely eliminated family planning funding from the state budget for 8 years. And despite multiple attempts to override his veto, it was never successfully put back into the state budget until Governor Murphy took office. That was 6 years ago. That's not that long ago in our past. And we need to make sure that when we're looking to who's going to lead this state, that we're looking for folks who are going to not just protect, but prioritize access to reproductive health care, and that includes state funding for family planning. It includes training, security, and facilities funding. It means removing barriers and removing regulations and ensuring that everyone has financial and economic access to the health care that they need and deserve.
Maybe I'll ask you as well. Obviously, when you're seeing individuals who come in and politics has no place, but knowing the backdrop and knowing how much politics does play a role, and certainly as we're discussing right now, a focus on this as a justice issue, as a racial justice issue, what do you see in terms of a conversation that maybe individuals want to have with you, or how it's framed in any conversations that you have, or anything that affects the work you're doing? Is there an understanding or a focus on the political piece to this?
I know that I have quite a few colleagues who sought out legal counsel to determine what they can and cannot practice. And unfortunately, things change quickly, which contributes to increased anxiety and unnecessary stress and worry for providers who simply want to provide care to patients. I'm fortunate to work with a team, a public affairs team that keep me abreast of the information, but I can't tell you that I look at it real time, because my focus is not the politics at this moment. My focus is every last individual that walks through those doors to provide the care that they need and deserve, despite their immigration status. I'm not looking for immigration status or what zip code you come from, how much money you make, and your race, your gender. That just does not that's not something that's concerning to me. What I like to do is I treat each patient as a person that can go out and provide the education to the rest of the world. Because right now in this climate that we're experiencing, there's a lot of confusion, misinformation. And again, it's being influenced by politics where there's just no room for it. So I use each and every patient interaction as an opportunity to provide correct information, provide education, with hopes that maybe they may post it on their social media. Maybe the right words will get out and people will know that, especially right now, and I'm speaking for New Jersey, but I'm hoping that it can be in other places. But in New Jersey, our doors are open for everyone.
Jeanne, maybe to you, as we understand the impact of the politics that are there, even though they shouldn't be affecting decisions such as this, they are there and noted, not that long ago, we saw a governor who eliminated funding in so many ways and did harm. So it's not far, as you noted as was noted in our review in New Jersey. But what do you see, I guess, in terms of the politics, the confusing times as described, or however you want to frame it? But we know that's really, talking about challenging times and maybe decisions that we made that we think are unfortunate. What do you think that says broadly about, the state of our democracy? I mean, it's a focus here, right? Protecting our democracy. And we're having this conversation because I think, we're looking at this as this in total. When we look at so many things that are going on right now are in some ways, just a check-in on the health of our democracy. How do you see everything being related, and certainly this issue, with where we stand in terms of making sure our democracy is strong?
Yeah, I would say that when we think about how we want to be a democratic society, access to healthcare is, and Kaitlyn mentioned this, right? It's a human right, and it's a key to how we make fundamental decisions, decisions about our own self-determination. And abortion is an important, critical aspect for pregnant people when they're making decisions about their futures. And when we think about forcing someone to carry a pregnancy, that could have really long-lasting and even life-threatening consequences for their health, for their economic future. And so thinking about healthcare to me is like a baseline when we are thinking about having a functioning, healthy democracy. And I'll note, I mentioned earlier that we can think about abortion access as a racial justice issue. It's also a disability rights issue. It's a criminal justice issue. It's an immigrants' rights issue. It intersects with so many of the challenges that our democracy is facing, because it's just core to how we can determine our futures. And I'll just kind of circle back to the idea that, abortion is this popularly supported by large majorities. our opponents in this fight are not just trying to retrench on the right to abortion, the legal right to abortion, but we just saw in Ohio last week or the week before a vote. Ohioans voted down a measure where anti-abortion lawmakers were trying to make it harder for them to amend their constitution to support abortion. And so we see these extremists are willing to take away tools of democracy in order to control our bodies and our lives. And so it's really interconnected to voting rights as well and fundamental democratic issues.
Well, 100%. And maybe Kaitlyn will ask you if you concur in that. We are seeing Ohio, great example there, right, where there was an attempt to curb, people being able to speak their voice and make sure they're heard, and that ties in with voting rights and so many things you say. And certainly, if you don't want to hear from a majority, maybe that disagree with your position, right? If we're talking about the extremists here, then you try to curb and curtail voting rights as well. So certainly all connected. Kaitlyn, what do you see as the state of things in terms of nationally in New Jersey and politically, and how it impacts our democracy?
Well, I think to Jeanne's example, what we saw in Ohio is a direct result of them trying to prevent a simple majority from being able to put something on the ballot and amend the Constitution, make it harder to amend the Constitution, is a direct result of the other ballot measures we've seen when it comes to abortion throughout the past year or so. Every time there's a measure to either protect abortion access or enshrine abortion access into their state constitution, it wins. Abortion is a winning issue. And we talked about, unfortunately, abortion being politicized, and to us, it's not a political issue. I would be remiss if I didn't say abortion is a bipartisan issue. Overwhelmingly, when you ask folks, regardless of their political affiliation or how they tend to vote, people in New Jersey and people across the country want abortion to be legal, whether or not they would ever choose to have an abortion themselves. When you ask folks, when you talk to folks, they say, I want abortion to be legal.
Well, maybe I'll go to you on this. I know that you've noted a number of times the politics, not having a role here. We know in some ways it does in the background, but I guess to you, I'd ask, what do you say to people when you say someone says, what can I do? Because oftentimes the answer is, I think of it as a political one, right? So people say, well, here's what you can do. Make sure you support individuals who support this or do that. But what do you see as what people can do? You mentioned before, you hope others see this and realize New Jersey, here we are, welcoming to say we can help. What are some ways that people can help, I guess, from your perspective?
From my perspective as a provider within Planned Parenthood, one of the everything we do here wouldn't be possible without our supporters. So I guess by encouraging listeners who are already supporters and who want to become a supporter, by donating to your local Planned Parenthood can help us to keep our doors open to continue to provide the care for patients. So that's like the number one thing outside of the education aspect of it. But for sure, supporters should definitely consider donating to their local Planned Parenthoods.
Well, there you go. Always a big financial piece of it as well. Jeanne, Kaitlyn, to you as well. I mean, you talked a little bit about it, right? Even at the state level, whether Chris Christie, no money, Murphy money, and support more broadly. So that's a money point as well. But what can people do to really help support and preserve reproductive rights and healthcare and just so many other spaces where democracy is under attack?
Well, right now, the ACLU of New Jersey and our partners and our coalition partners at Thrive and the Thrive Coalition's the coalition that Planned Parenthood and we are part of, we're supporting the Reproductive Equity Act, and that is a bill that would enshrine some of the policy provisions Kaitlyn and I were talking about earlier. And so you can go to the ACLU of New Jersey's website, aclu-nj.org, and click on the abortion tile on our homepage. And there's a whole list of ways you can support the Reproductive Equity Act and, calling state lawmakers and even just knowing your rights. Being armed with the information about your rights is important because then you can share it with others and you can be confident in talking to people about why this is such an important issue.
And I'll just add, if folks are looking to get involved, they can visit ppactionnj.org as well. We have groups of community members who come together on a monthly basis all across the state to take action call their lawmakers, write postcards, write handwritten letters to leadership. We're coming together every month to make sure that folks know that they can take action on the issues that they care about. So again, ppactionnj.org.
Well, Kaitlyn, maybe I'll ask you to start and go back around with everybody, because what you just finished is something that I think you'll probably use in your answer here. But, if I was to ask you what gives you hope, we've talked a lot about, the ways and spaces how we're under attack, and certainly decisions are being made, that aren't between the interest of a doctor and a patient for sure, and so many other things. But what gives you hope? I would imagine one of the things is, as you just noted, seeing people come on out and do things. But I'll ask you and then ask the others, is what gives you hope as you look at the challenges? I think what gives me hope
is that we're seeing wins in places like Ohio and across the country when it comes to these ballot measures. We're seeing folks come out and vote in favor of enshrining rights into their state constitution when it comes to abortion, or beating back anti-choice constitutional amendments. We're seeing folks across the country rise up and come together to make sure that our neighbors, ourselves, our friends have access to the healthcare that they need and deserve. And that really truly gives me hope in some of the darker moments.
Rahbbea, how about you?
So here in New Jersey, we are removing barriers and increasing patient access. For quite some time, we have provided and we will continue to provide Uber Health, which arranges transportation to and from our health centers at no charge to the patients. We also have a developing patient navigator program, which alleviates a lot of the burden for our patients seeking abortion care. So if a patient is unable to have an abortion within our affiliate, our navigators are helping to get them to the care that they need. Our navigators are also establishing relationships with other abortion providers and facilities that in some cases are outside of the states. So I think that this program alone will be essential in increasing access for everyone, including out-of-state patients and patients with special considerations. So that is providing me great hope. And again, our supporters are providing me with great hope for New Jersey as well.
Yeah, no question. Even when Governor Christie took those actions years ago, I know the support that came in for Planned Parenthood was immense and needed, of course. Jeanne, how about you? What gives you hope in these times?
I'll co-sign what Kaitlyn and Rahbbea talked about, and I'll add that there's also the New Jersey Abortion Access Fund, which is a statewide fund that takes donations to support making sure patients get to the providers they need to get abortion care. And there are other local support networks that people can look at. And so seeing the energy around supporting abortion access funds, turning out for things. And then I'll just say, like, people like Rahbbea and others on the front lines who are providing this care fearlessly, fiercely, like they're showing up every day. And it's hard work. And I'm just so grateful and inspired by all of the folks on the front lines.
Well, listen, I'll just say this. I'll say, sitting in my seat, I'm inspired by all of you. Thank you. And so many who are doing the work, because if not for everybody, in their roles, in their ways, trying to do what they can, politically, legally, on the front lines, then we don't see success. And you guys are perfect examples of all of that and more. So I just want to say thank you to all of you for being on. Hopefully we did help to share a little that inspires others, yes, with the work that you do, but also informs them and allows them to use that knowledge for power, and certainly to maybe recharge and look ahead and for successes that we're going to see together as we work, to continue to move arm in arm. So thank you all again for being on, and thank you for sharing a little time with us today.
Thank you.